Hello, I'm Dr. Tom Drake, and today I want to share some important tips to help you parents potentially spot OSA in your children. I was reading a medical journal the other day, and it said that children who are born prematurely or have a parent who has OSA or a family member that had a tonsillectomy are at much higher risk to have sleep apnea than other children. You see, premature babies often have breathing issues due to the immature development of their lungs and airway. And unfortunately, this sometimes follows them later on in life with other breathing disorders, such as obstructive sleep apnea. And because of the size of a person's airway is largely determined by genetics, it only makes sense that if one or both parents have OSA, then there's a high likelihood that their children will also have it. The article went on to say that snoring, restless sleep, and long-term bedwetting are very common characteristics of kids with severe sleep apnea. But just remember, if one of your children displays these symptoms, it doesn't automatically mean that they have OSA. But what it does mean is that if your child was born prematurely, or snores, or tosses and turns while they sleep, or any of these other factors that we talked about today, you need to take them to someone who is trained in sleep apnea and get them checked out. Early detection can save them from serious medical conditions later on in life, such as cardiovascular disease and type 2 diabetes. I hope these tips have been helpful to you. This is Sleep Talk with Dr. Tom.